Good evening and many thanks for watching KTN. My name is Dennis Aseto. Welcome to this edition of Health and Wellness. And today we're talking about the country's biggest burden, which is cancer, where 44,000 Kenyans lose their lives annually due to cancer cases in the country, with the trajectory showing and statistics indicating that these numbers are likely to increase. But one asks the question then, where are we in regard of research development in terms of getting statistics and acting on the same as well? We shall be delving deeper as looking as to other regions in the country where cancer cases tend to be higher than other regions in the country. Specifically, we shall be looking at Mount Kenya. And to have this discussion with us today is Dr. Joseph Maget, who is an oncologist at HCG Cancer Center. Karibu sana daktari.
Thank you so much.
Yeah, daktari, cancer. Everybody hears cancer and oh my God, it is a death drop. Is it?
Not really.
Yeah.
I'm thinking long ago when cancer was still new, people would die of cancer, but now in our country, in the world, there are newer ways and newer techniques to treat cancer, giving people survival for many years. So cancer is not a death sentence, but it is one of the biggest causes of death in the world. But we can fight cancer and you can win.
Yeah. I mean, when you talk about cancer cases in the country, you know, 44,000 deaths annually, and that is mind-boggling, you know, because it's huge.
Yeah.
But then again, you look at what that means and investments that should be put in place to deal with that. Where would you rate Kenya in terms of preparedness or investments towards dealing with cancer cases in the country?
I'd like to say that there is a lot of goodwill amongst the people of Kenya and also the government and also even the private institutes in terms of fighting cancer. When we look at cancer, where we were 10 years ago and where we are right now, we're miles ahead. We're still not where we want to be, but in the future, we will be, cancer will be one of the most advanced treatments in the country. Well, when you look at the government, initially, the number of cancer centers we had, hospitals that could treat cancer, there were very few. We would say maybe Kenyatta or Moi Teaching and Referral. But if you look at it currently, we have more cancer institutes that treat and cancer. Also, when you look at in terms of training, currently the University of Nairobi is training oncologists, which was not there before. It's a new program. If you look at KMTC, they also train clinical officers in oncology. We have training of nurses who specialize in cancer treatment. So there is a lot of goodwill. Okay. When we're looking at advancements in terms of cancer treatment, or when you look at the availability of diagnostic machines, we're talking about MRI, we're talking about CT scans, we're talking about well-equipped labs and PET CTs. These are things that weren't there before, but currently the number is rising gradually. So even in terms of treatment, when we talk about newer medication, immunotherapy, we're talking about radiotherapy, new radiotherapy techniques. This is available in our country right now. So there's a lot of goodwill in terms of fighting cancer. Yeah.
So we've looked at, so there is investments with what the government is doing, as well as SHA as well has special coverage for would-be cancer patients. Speak to that as well.
Yes. Currently, we have a special package, a SHA package, which just deals with oncology treatment. That covers chemotherapy, radiotherapy, and also it covers diagnostics and pathology. So all this is covered under SHA. Initially, before, we didn't have a separate package for oncology treatment. Yeah.
Dr. You see, when we talk about cancer cases in the country, many say while cancer, the best way to treat it is when you diagnose it early,
Yeah,
right?
that's true.
And with that then is what you've actually addressed, diagnostic machines
Yes.
that are needed for us to be able to screen early, then start dealing with the problem early.
That's true.
How would you rate is our health-seeking behavior as a country, especially when it comes to being able to deal with cancer early?
Well, unfortunately, in our country, our health-seeking behavior is a bit poor because most of the cancer cases we get, they're usually late stage. When I say late stage, I mean these are cancer cases that are stage 3 or stage 4. So when you are coming to hospital, the cancer is already advanced, so making it treatment a bit complicated.
Yeah.
But when the cancer is early, you have many options of treating. There are options of surgery, there is option of doing chemotherapy and radiotherapy. So our health-seeking behavior is still very poor. That's why we encourage most of our Kenyans to come forward and go to hospital for screening, because these screening services are available in any health facility. You just go and you ask for screening. You'll get the services. Yeah.
When you talk about different cancers that we have, they've been associated with the kind of lives that we live, the sedentary life, the lives that we see. Many of us now are living. We are not working out as much, the kind of foods that we're eating. Would you reckon that this predisposes someone or exposes someone to cancer more, as compared to back in the days when everybody was walking, everyone was in the shamba doing here, and the people were active, eating foods that you would trace where it's coming from. You know, we were from the shamba to the table. Would you say that the sedentary lifestyle that we live nowadays has exposed many would-be a Kenyan to cancer cases, if that's a question that one would want to ask?
Yeah, I agree with you. I think lifestyle choices and plays a very big role in cancer. When we look at smoking, which is one of the leading causes of cancer, is one of the reasons why people get cancer. 2, exposure to alcohol. People are drinking a lot. This also might increase the chances of getting cancer. Third thing is nowadays people don't do exercise, which has been shown to have a good effect on fighting cancer. So sedentary lifestyle plays a role, but also I'd like to touch on the fact that for you to get cancer, you have to be, there are a lot of factors that come in play. So first of all, it's your genes, okay? You might find that in the family, there are people who, like let's say your father or your mom or your sister had a certain type of cancer. You might be at higher risk compared to the normal person to get cancer. Second thing is now environmental exposure. When we look at exposure to certain types of chemicals, okay, maybe farm chemicals, we're looking at if someone is working in an industry or in a factory, they might get exposed to certain types of chemicals. Third thing now is what we call now lifestyle. Lifestyle now is you are smoking, you're drinking alcohol, you're not exercising, your diet is poor, you're eating processed foods. All this now combined leads to having a high burden, like now a higher risk of getting cancer.
You know, we also live in a country where we're getting to look at disease burden now that we have devolution, and also just in terms of mapping out where what affects one county, one region. We find that the mountain part of the country is seeing more cancer cases that are coming from the region, and anyone would ask the question, why? You know, what are some of the reasons, perhaps from where you sit as a medic, that the region is recording increased numbers? Because we can also talk about investments, intentional investments that you're seeing going towards the region. Why high numbers in the mountain region?
The higher numbers, we can only try and speculate why the higher numbers. First is we know that the central or Mount Kenya area is very agricultural dependent.
Okay.
So there are a lot of people who are farming, and when you're farming, there's exposure to certain types of chemicals, herbicides, pesticides, and all. This can be one of the exposures to having high cancer cases. Second thing is we look at, as I said, lifestyle choices. Maybe there are a higher number of people who are smoking and also drinking in the central area. I'd also want to say that even though we see the numbers increasing, that can also be that we have been able to mobilize people to go and seek healthcare, so that maybe there's increased number of screening. Maybe the facilities now have expertise to diagnose and identify cancer early. Yeah.
Yeah. You've mentioned something that is very critical, because I remember when HIV/AIDS was just new in the country,
Yes.
There's always been more numbers that is recorded from the Nyanza, the Nyanza belt.
The Nyanza area, yeah.
And I was talking to another doctor the other day and said, you can look at it in different ways.
Yes.
Perhaps it's also lifestyle choices that
Yes.
many have taken,
That's true.
but also because many people from the region go to get tested.
Yes.
So definitely the numbers would differ from other regions. Yeah.
Yes.
But even while at that, then we look at investments that have gone into place,
Yes.
and we're looking at regional development that is going into the Mount Kenya region, because
Yes.
there is seemingly a targeted approach towards addressing cancer. So there is a cancer center in Embu and Nyeri, I think.
Yeah.
And
true.
with this, then one would look at it and ask, the government is being intentional in addressing this, and how does that then help the medical fraternity, doctors, oncologists like you, in terms of being able to address the problem in that region, as opposed to before some was coming to Kenyatta?
That's true.
Yes.
I'd like to say that, as I said earlier, the investments in terms of oncology centers in the country has gone up. We are having more hospitals that can treat cancer cases as compared to where we were 10 years ago. But we're still not where we need to be. Okay. When you look at central region, we don't have any radiotherapy machine in the central region of the country. So a lot of the people who are diagnosed with cancer and they need the radiotherapy services, they have to travel all the way to Nairobi or to other counties to get this radiotherapy. Okay.
I get it that many have to travel. So now there's no radiotherapy in the region. But we agree that there is a disease burden in the region that needs to be addressed.
Yeah, and one of the ways in which the government can address this is the best way to fight cancer is screening.
Yeah.
Early, when you screen and you get the cancer early, you can treat it early and you can fight it. When you look at central Kenya, when they were talking, when the government, the CS for Health was talking about the types of cancers that are higher in Nyeri or in the central region, we found that breast was amongst women was the highest, and cervical cancer, prostate for men, and esophageal cancer.
Okay.
Now, for breast, we see that there are many ways in which we can screen for breast cancer, and we need this available in the counties. I don't think we have enough mammograms or ultrasound machines to screen for cancer. Second thing is cervical cancer is one of the most preventable cancers in the world. When you look at the Western countries, the diagnosis of cervical cancer is very low compared to us in Kenya. And we have a vaccine for cervical cancer, the HPV vaccine, which is available. And we need to encourage young girls to go get the HPV vaccine, because once you get the vaccine, your chances of getting the cervical cancer reduce significantly. For prostate, we have a screening test called the PSA, which is just a test for, they take a bit of your blood, take it to the lab, and within an hour, you have your results. These are modern ways in which we can fight cancer, and we need this available in the counties, in the Mashinani area. Yeah.
Yeah. You see, Doc, you've mentioned something that I think we just need to debunk it out here, because already we agree that men have a poor seeking behavior.
Yes,
As
true.
men, hospitality,
No, yeah.
you know, that needs to change from the
Yes,
word go.
yes.
But then again, when it comes to even men then going to get tested for prostate cancer,
Yes.
many know the old school way
Yes,
of
of
how the
testing.
test was being
Yes,
done, and
yes.
many men say that is too invasive and they
That's
don't
true.
want to go do it.
That's true.
So I think it's important for us to just say it out there that there are new and modern ways of doing
testing,
it,
yes.
and that they can go get tested and
Yes.
start treatment early.
Yes.
Yeah. But I think it's better coming from a doctor.
Yes, a lot of men,
Yeah.
they are afraid of their dignity as they're going for the testing. But now, when it's not as invasive as it was before, where you can just take a sample of your blood, and once the test is done, you can know whether you're at risk or not at risk. So we also have ultrasound machine, which is also not as invasive. We have the MRI machine, which we use to diagnose all these cancers. So I think I'd want to encourage the men, especially the men, to seek prostate screening, because a lot of them come too late, and it's usually very the treatment is usually more complicated as when it's earlier. Yeah.
You know, you've mentioned the HPV vaccine, because I know the country launched, I think it's a strategy plan on how to address the same, with the vaccine then being pushed heavily by the government. We know we've dealt with, we have anti-vaxxers in the society. We've equally dealt with, there is the culture and religion that does exist. And from where you sit in like a minute before we take the break, how do these things that do exist, so it's our culture, don't get vaccinated. We also have anti-vaxxers. You know, we also have our religion. How do those then affect individuals in seeking assistance early and further treatment when one is diagnosed? Because one way or the other, people will, if you're sick, you go to a hospital.
Yeah, that's true. One of the things that affects our health-seeking behavior is our cultural practices, our religious beliefs. We have seen a number of people who are usually against even screening for cancer, just getting the vaccine, and statistics already show that the vaccine reduces the chances of you getting cervical cancer significantly. Well, I think the government has to come on board. They have to address these matters. Because when we go back to the community, we need to educate these people so that they understand what we are doing, these measures we are doing, they are not to try and harm you, but it's for benefit. If we look at treatment of cancer itself, it's very expensive. Our families are struggling the government has to invest heavily. But if we can prevent this disease early enough, we'll be able to save a lot in terms of costing and resources.
Dr. Joseph Mageto is an oncologist with the HCG Cancer Center. We take a short commercial break. When we come back, we look at affordability of the same and what perhaps needs to be done for many Kenyans are able to afford the same, as well as looking at some of the causes that you can avoid so that you don't expose yourself to what would be a cancer that you're dealing with, especially esophageal cancer. What are some of the things that might expose you to the same? We'll take a short commercial break. We'll be back with much more. And thank you for watching KTN. Welcome back. This is Health and Wellness, where tagline, forever remains your health is your wealth. Dr. When we went on the break, right, we've looked at investments, we've looked at some of the cancers that we see. But let's look at esophageal cancer, right? That has also been highlighted as being one of the cancers as well that we see from Mount Kenya region. And with that then, what are some of the causes of esophageal cancer that one can avoid to avoid to prevent themselves from perhaps getting cancer?
As I said earlier, one of the risks that exposes people to, when the exposure comes, is smoking. Smoking is one of the leading causes of all these cancers we're talking about.
Yeah.
So just being able to discourage people from smoking cigarettes. Nowadays we have other forms of nicotine which come in forms of shisha and the vapes for the younger people. We need to discourage people from using this. Most of the patients who come in, you ask them, they'll tell you they have a history of smoking. Well, we are still doing research on the diet, and some of the diet people are having. Could it predispose people to getting these forms of cancer? Okay, maybe taking certain foods or drinking hot beverages. Could this predispose people to this cancer? It's still not yet found out, but diet and smoking and alcohol use, these are the leading causes for esophageal cancer. Yeah.
Yeah. Now, Doc, the big elephant in the room when it comes to cancer is the cost.
Yeah.
The cost is not affordable
That's
in
true.
any way. You know, they say when it's cancer, there's a high possibility that that family might just end up in poverty because of how resource intensive it is, you know. And coming from a country where now we are trying to set up facilities that will help us deal with this problem. How would you reckon the cost as well is, and the cost here comes from even government investment and lack of resources, you know. How is it preventing the country, even doctors, from doing their jobs diligently to treat patients?
When we look at cancer treatment, we look at in terms of global perspective. When we're looking at the treatment, we touch on the medication you're getting, the services like radiotherapy. We're looking at diagnostic services. We're looking at nutritional services. So when all these things, palliative services, all these things come together, you find it's very resource intensive. A lot of families, we meet a lot of people who have sold almost all their property so that they can treat one person who has cancer in the family. The relatives, someone has to stay back, take someone, the person who's sick to hospital. That means this is someone who is not working to build the economy. They are coming to hospital with the patient so that they can get treatment. When we look at fundraising, every now and then you hear someone is fundraising for treatment, locally or abroad. So these are some of the areas where you see now how intensive it is. There's no figure to it in terms of money that one person spends to treat cancer, but you can look at it from that perspective and you'll see it's very intense, expensive for the family, for the government, for private institutions, Yeah.
And with the cost and affordability then being a concern, there is need then for solutions to that aspect of cost to be addressed, where then we enter insurance, right? And with insurance then being in place, how is that then a game changer for would-be patients whenever they go for treatment, whether it's private insurance, whether it is SHA? How critical is it to the lifeline of a patient and also to the future of the family that is dealing with a loved one who is sick?
Insurance plays a very big role. At private insurance or SHA, what happens with insurance is we do what we call pooling of funds, where every person contributes a small amount so that maybe the people who are diagnosed with the disease can get treatment. Now, this comes on board and rescues the patient and their family from what we call out-of-pocket spending. if let's say you would have paid, let's say 70,000 to do a PET scan, and SHA covers for it, that is going to save the family and the relatives and the patient a lot of money, which would have gone to spend on the treatment for cancer. So insurance has played a very big role in terms of cancer treatment. Yeah.
Yeah. Another thing, Doc, that has happened is for a very long time we have seen patients leave the country for treatment outside.
Yes.
You know, so India has become I grapple with that term that it is the medical tourism is now a reality in India.
Yeah.
You know, but then with the investments that you see happening is more and more Kenyans, because of improvement on our facilities and resources being poured in, many are being treated locally.
Yes.
How is that a game changer, and what does that mean to the trust and believability that our local facilities, our local doctors can deal with this burden?
Yeah, from where I sit, I see this every day. We do get people going abroad to India, then they come back and they realize actually these services are available in our country. I'd like to mention one of the key diagnostic features we have in our country is the PET CT scan, which 5 years ago we didn't have a PET CT scan in our country, or we had just one, but now we have about 6 of them in the country. This is why people are going abroad to seek such services, which we have locally. When I say radiotherapy techniques, which were never, they weren't there 10 years ago, now we have what we call SBRT, which is new ways of treating cancer that you get locally, which when you go abroad, you'll still have to get the same treatment. Newer drugs, immunotherapy, targeted therapy, we also have them in our country, locally available. So I like to encourage people to just give Kenya a chance. We have local institutes which are able to treat these cancers, as well as abroad.
Yeah. And you see, you've said something that is very critical, where give Kenya a chance, you know, give Kenya a chance and trust that doctors can be able to deliver. And with that, then, you know, for a very long time, it has been because this information perhaps has been sold that we can't do it. So that is what has remained. So how do we bridge that gap from professionals like you, the media, the government, in pumping that information to Kenyans and telling them that this can be done locally, you don't need to leave the country, as well, even in the coverage that is in SHA or any other private insurance that is there, to tell individuals that the first cause of assistance will be locally, because we can offer this. That which we can't, perhaps we will then make a referral.
Make arrangements. What we can do is, first, we really need, as we are doing right now, we really need to educate the common Kenyan, so that they understand these services are available locally. So that is in partnership through the government, through private institutions, through NGOs coming together and promoting our own healthcare facilities. Second thing is, you know, about 10 years ago, we didn't have enough personnel, okay? We still are not there yet, but the numbers have increased, okay? We're looking at University of Nairobi training more oncologists. We're looking at Kenya Medical Training College training more clinical officers to identify what cancer is and how maybe to refer to the specialist. So we need the goodwill. We need the goodwill. We need to work together and educate people and educate the Kenyans.
You know, when you look at stats as you speak at the moment, is Kenyatta National Hospital and some private hospitals have been known to be the ones who are meant or have the capacity to deal with it. But now, as we even talk about Mount Kenya, if you just listen to Kerugoya Hospital and what it has done, like 3,000 people being dealt with, being addressed on matters to do with cancer. And that is mind-boggling, because that then would mean 3,000 people who would have then left Kerugoya coming to Nairobi. So Kenyatta has been left to deal with other cases, you know. And these are the kind of investments then that the medical fraternity, the medical sector needs to see. But even as we talk about numbers, right, University of Nairobi now is offering these training facilities, but still we are way low, below the numbers that we need to see. If we were to have an honest conversation, right, what must government Ministry of Health do to ensure that we see more numbers, because having more numbers of professionals mean more people get the assistance?
Well, one of the ways in which we can do this is, first of all, government employment. Okay, we need the goodwill from governments, the county governments, to employ, because there are certain doctors, nurses, we all know that they are not employed, they are unemployed, and these are people who can come in and give their services, because the training itself is very intense, very expensive.
But even then, Doc, I want us to look at, there is a decentralizing, because if you look at healthcare, it's predominantly devolved.
Oh, yes.
So we have the counties that one would say are dealing now with the preventative aspect of the same. So here enters the CHPs, the community health promoters, you know, level 1, level 2, that then would deal with the screening and even information sharing, you know. How critical is it for us to look at the counties as the first place where preventative medicine is pushed?
Yes, and I think that's the whole basis of this UHC that we are trying to achieve. We need the level 1, level 2, level 3 hospitals being able to have these screening services, okay? Having people who are trained to identify what needs to be referred, okay? So that when you're looking at now Kenyatta Hospital, when you're looking at KU or Moi Teaching, you only refer only the cases that need super specialists who can now treat this. Okay, when you look at the county hospitals, I think we all need, let's say, at least an oncology team in all the county hospitals, at least an oncologist being available, and oncology nurses, okay, so that they can be able to treat and also be able to offer the services.
Doc, you see, we will talk about the government needs to pump in money, right? The county governments need to pump in money. But healthcare is personal. And it's personal in the sense that it starts from me, then my immediate family, then perhaps the community. And by the time I'm getting to go to knock to the doors of the county or a hospital, an entire community is affected in one way or the other.
That's true.
Yet you find that many, in terms of even community health promoters, the reason why they are there is because they are in touch with the mwananchi at that basic level, right? So in terms of healthcare, from the community level or even from the family setting, how are Kenyans addressing or approaching healthcare? Because by the time someone is calling for a Harambe, it's because they've wasted so much critical time. You know, so from the community's lens, what must we change? Because that's information that needs to get down there.
Yeah, I agree with you. It starts from a personal, individual level. People need to understand that you need to go to hospital early. You need to go get screened. For ladies, you need to get the HPV vaccine, okay? You need to go get your mammogram. For the male, the prostate screening, okay? So this starts from an individual level. We then grow from there at a family level, okay? Where the family, we talk about these things openly, okay? It should not stigmatize any person who has cancer. I've met a lot of people who come for treatment and they tell me, no one is talking to me in my family. They're afraid that I might give them the disease. So these are things, the myths we need to debunk, okay? In the community level, we need to have local churches, we need to have schools teaching children what cancer is and how to go about the treatment, how to take care of the elderly, the local people who maybe have the disease and they have no one to take care of them, okay? As we now from that local level, then now will be able to go further now and go now county-wise, then national-wise.
National.
Yeah.
Yeah. Dr. I want us to look at cervical cancer.
Yeah.
And a lot has been said about, because many say that's a women's disease. It's okay.
Yeah.
It is understood to be so.
Yeah.
But what role do men play? Because there are many who say men are carriers. Men could infect. Is it a myth? Is it factual?
Yeah. So from what we know about cervical cancer is 90% of it, more than 90% is caused through infection of the HPV virus, okay, which is transmitted sexually between men and women. So men can be carriers, but also the women can be carriers too, okay. That's why we do encourage people to get the vaccine early. We are also thinking if maybe also boys and young men could get the vaccine also, so that they also don't get affected by the HPV vaccine, the HPV virus, sorry. We see that even though cases in men are few, but there are still men who come with HPV cancers like penile cancer, okay, head and mouth cancer. So, yeah.
Yeah. Doc, you know what you've just done is you've opened a can of worms, yeah? Because now when you're talking about HPV, we're talking about HPV from a point that the disease is known to severely affect women.
Women, yes.
Right? But that men are equally not left out. It is not common, but you are a candidate.
Yes, you can
and that is where then men as well must come on board and even themselves seek for vaccination, because vaccination, whilst we encourage more women to take it, it is important for men as well also, who would be carriers or who would have these cancers to have the vaccine.
You're right.
How would that be a game changer in terms of now dealing with cervical cancer?
First of all, we know that the exposure, when you get exposed to this virus, your body will be able to fight it. So you're not going to get the cervical cancer. So there was a study that was done in Ireland where they saw that the cases had reduced significantly. About 96% of all the ladies who were vaccinated, there were about zero cases of cervical cancer. Also, in men, as we've discussed, that there are some certain cancers that you might get as a man once you get exposed to this. So that will also reduce. So all these investments we are doing for cervical cancer, we'll have to shift it to other types of treatments.
Dr. If you were to speak to a Kenyan right now who's watching us, a Kenyan who, number one, is concerned about uptake of insurance, whether it is SHA or private, how critical is that? Number two, a Kenyan out there who is thinking my culture, my religion, you know, there is a stereotype that does exist, I will not go to hospital. What would be a message to them, as well as to government, to other health practitioners in terms of dealing with cancer?
Well, I'd like to advise all the Kenyans that having insurance for health saves a lot for you and also for your family and your community, because insurance helps you to cover finances where maybe it will be too expensive, you can't afford. Okay, so we encourage all the Kenyans to go and register for insurance, okay, be it private or public. For the government, there's goodwill in terms of fighting cancer, but we're still not where we need to be. We still need more facilities. We still need more machines, diagnostic machines. We still need more specialists, okay? So we do encourage the government to look into it. There are still many unemployed young people who already are trained. If they can get absorbed, so that they can also be able to provide these services to people.
Daktari, I want to get you today for advice. Nakupata wapi?
You'll find me at HCG Cancer Center which is in Parklands, next to Mpisha. Yeah, any day of the week.
Yeah, yeah. You see, when we talk about matters to do with healthcare in the country, it is personal. We agree. It is personal in the sense that it is an individual that is dealing with the disease, but there is the family, there is the community, and there is the burden that comes to the country as well. Therefore, what is your responsibility in taking care of yourself, avoiding those which would predispose you to getting cancer, as well as our health-seeking behavior? It is stinking, for that word. Yes, it is stinking, but we can do better about it. But remember that we equally have professionals in the country trained and can deal with the scourge that we continue to deal with on a daily basis. I want to say asante sana to Dr. Joseph Mageto,
Thank you.
who is an oncologist from the HCG Cancer Center here in Nairobi, as well as the entire team that has made this production a success. Asante sana. We keep on telling you every other day that your health is your wellness. I'm Dennis Aseto. Bye-bye for now.